federal health officials have confirmed that a specialized repatriation operation is underway to monitor and contain a rare strain of hantavirus, known as the Andes virus, following a deadly outbreak linked to an international cruise ship. The Centers for Disease Control and Prevention, along with the World Health Organization, has identified a cluster of infections originating from the MV Hondius, a Dutch-flagged polar expedition vessel that departed Ushuaia, Argentina on April 4, 2026. As of the second week of May, the outbreak has resulted in at least 9 confirmed or suspected cases and 3 fatalities, including a Dutch couple in their late 60s and a German woman. While the primary mode of transmission for most hantaviruses involves the inhalation of aerosolized particles from the waste of infected rodents, the Andes strain is unique and globally significant because it is the only known hantavirus capable of person-to-person transmission. This biological characteristic has prompted high-level surveillance across multiple continents as passengers from the vessel disembarked and traveled through international transport hubs, while a headline-level alert suggests the virus is spreading through U.S. airports. Current data from the CDC indicates that the public risk remains extremely low, and the movement through airports refers to the targeted tracing of specific travelers who may have been exposed during their journey home. The situation began to escalate on May 2, 2026, when the United Kingdom notified the WHO of a cluster of severe acute respiratory illness among the 147 passengers and crew on board. Initial laboratory testing conducted in South Africa and later confirmed by genomic sequencing in Europe identified the pathogen as Andes virus. Public health framing of this event focuses on the imported nature of the cases. As the natural rodent reservoir for this specific strain, the long-tailed pygmy rice rat is not found in North America or Europe. Officials are operating on the working hypothesis that the index cases were exposed during excursions in endemic regions of Argentina or Chile prior to boarding the ship. Because the incubation period for Hantavirus Pulmonary Syndrome can extend from 4 days to as long as 6 weeks, the CDC and state health departments are maintaining a wide window for monitoring. The current focus is not on community spread, but on the precise management of individuals who had close, prolonged contact with symptomatic patients in enclosed settings, such as the cabins of the cruise ship, or during the long-duration flights that followed the ship's stops in the South Atlantic and the Canary Islands. The operational core of the response is currently centered on the University of Nebraska Medical Center in Omaha, where 17 Americans and 1 British resident are being transported via specialized biocontainment flights. According to the Department of Health and Human Services, at least 1 American passenger tested mildly positive via polymerase chain reaction testing while in transit, though the individual remained asymptomatic at the time of the report. This passenger, along with another traveler showing early symptoms, was transported in a high-level biocontainment unit out of what officials call an abundance of caution. Acting CDC Director Dr. Jay Bhattacharya stated in recent briefings that the agency is also tracking 7 additional Americans who left the cruise ship earlier in the voyage and have already returned to their homes in Arizona, California, Georgia, Texas, and Virginia. State health agencies in these 5 locations are conducting daily symptom monitoring to ensure that any development of Hantavirus Pulmonary Syndrome, or HPS, is caught in its earliest stages. The clinical progression of Andes virus is notably aggressive. After an initial prodromal phase of fever, muscle aches, and gastrointestinal distress, the disease can rapidly transition to respiratory failure and shock. The World Health Organization reports a case fatality ratio of approximately 38% in the current cluster, highlighting why international health regulations were triggered so rapidly. Lab investigations are currently focused on determining the exact viral load required for human-to-human transmission, as historically this has only occurred through intimate contact or shared enclosed spaces over long periods. In response to the potential for aerosolization in medical settings, the CDC has issued a Health Alert Network advisory recommending that any suspected cases be managed in airborne infection isolation rooms. Healthcare providers are instructed to use N95 respirators, eye protection, and fluid-resistant gowns when entering a patient's environment. This level of clinical precaution reflects the uncertainty regarding the Andes strain's efficiency in spreading via respiratory droplets compared to other hantaviruses. Despite these rigorous protocols, both the CDC and the European Center for Disease Prevention and Control emphasize that there is no evidence of the virus circulating in the general population or among casual travelers who did not have direct contact with the identified cluster. The tracing of flight manifests is a standard epidemiological ring strategy intended to identify anyone who sat in the immediate vicinity of a symptomatic traveler, rather than a sign of a widespread airport-based epidemic. Prevention and public health guidance for the hantaviruses outbreak remain focused on containment at the source and rigorous surveillance of known contacts. For the general public, health officials reiterate that there is no need to change travel plans or adopt special respiratory protection in public spaces like airports, as the risk of contracting a hantavirus in an urban or transit environment without rodent or known case exposure is negligible. The CDC's current guidance for travelers returning from South America, specifically the Andean regions of Argentina and Chile, includes avoiding contact with rodents and their habitats, such as woodpiles or neglected cabins. In the context of the current human-to-human concern, the guidance is even more specific. Avoid the sharing of utensils, drinks, or cigarettes with anyone showing flu-like symptoms who has a relevant travel history. There is currently no specific antiviral treatment or vaccine approved for hantavirus infection, making early supportive care and intensive care management the only effective interventions. This clinical limitation underscores why the surveillance of the 15 countries involved in the MV Hondius itinerary is so intensive. National health focal points are working to reconcile the list of passengers who disembarked at various stops, including the Canary Islands and South Africa, to ensure no one slips through the monitoring window. Honest limits of knowledge remain regarding why this specific outbreak occurred on a maritime vessel, a setting not typically associated with hantavirus. Epidemiologists are investigating whether a rodent was introduced to the ship via supplies, or if the transmission was entirely human-to-human after the initial exposure in South America. While the term airborne is used in the context of hospital isolation protocols to describe the highest level of safety, officials stress that this does not imply the virus is as transmissible as common respiratory pathogens like influenza. The situation is being managed as a localized cluster with a high impact on those infected, but a low probability of broader geographic expansion. As the monitoring period for the current group of travelers concludes over the next several weeks, health agencies expect the number of new cases to stabilize. Public health reporting will continue to prioritize the verification of lab results over speculative reports of spread. For continued updates on international health notices and regional surveillance, viewers are encouraged to monitor official dispatches from the CDC and the World Health Organization. Please consider subscribing to remain informed on developing public health reports. The operational response to the Centers for Disease Control and Prevention's confirmation of the Andes virus strain is currently prioritizing the reinforcement of the Division of Global Migration and Quarantine at major international transit hubs. Unlike common North American hantaviruses, such as the sin nombre virus, the Andes strain is characterized by its documented capacity for person-to-person transmission, which has fundamentally altered the standard containment algorithms used by federal agencies. At the center of the current developments are the specialized CDC quarantine stations located at key U.S. airports where officials are implementing enhanced screening protocols for travelers arriving from regions where the virus is endemic. These facilities are designed to identify symptomatic passengers before they enter the general population, utilizing a combination of visual assessments, non-contact thermal scanning, and detailed travel history questionnaires. Because the incubation period for Hantavirus Pulmonary Syndrome can span several weeks, the agency is focusing on the airborne designation mentioned in official reports. In a clinical and epidemiological sense, this refers to the risk of aerosolized droplets in close-quarters environments, such as airplane cabins or crowded terminal gates. This specific transmission route is why the CDC has moved to alert the Transportation Security Administration and port authorities to monitor for clusters of severe respiratory distress. Laboratory and testing angles are becoming the critical bottleneck in verifying the extent of the spread mentioned in recent bulletins. To differentiate the Andes strain from more common seasonal pathogens or other hantaviruses, labs must utilize high-complexity molecular testing. The primary diagnostic tool is the reverse transcription polymerase chain reaction, or RT-PCR, which identifies the viral RNA in blood or tissue samples. However, federal labs and state public health departments are also employing enzyme-linked immunosorbent assays known as ELISA to detect the presence of IgM and IgG antibodies, which indicate recent or past infection. Because hantavirus particles are extremely fragile and typically only survive in the environment for a short duration, the airborne confirmation has led to a reevaluation of airflow and ventilation standards within airport holding areas. Officials have noted that while the virus is traditionally associated with rodent reservoirs, the current concern regarding U.S. airports hinges on the potential for secondary and tertiary human-to-human transmission chains. Testing is currently being centralized at high-level biocontainment facilities to prevent accidental exposure to laboratory personnel, as the Andes virus requires specialized handling under biosafety level 3 protocols when being cultured or sequenced. The logistical and travel aspects of the report focus on the ring of surveillance surrounding suspected cases identified in transit. When a potential case is flagged at an airport, the CDC works with airlines to obtain passenger manifests for contact tracing. This involves identifying individuals who sat within a specific radius of the index case, usually defined as 2 rows in any direction for a duration of several hours. While the source material indicates the virus is spreading, health officials are carefully contrasting this with verified infection data. As of the latest briefings, the priority is distinguishing between those who are merely under observation and those who have received a laboratory-confirmed positive result. For travelers and airport staff, this has resulted in the deployment of updated personal protective equipment guidelines. In areas where the virus is suspected to be present, the use of N95 respirators is being recommended over standard surgical masks to provide a higher level of filtration against the fine aerosols associated with the Andes strain. This development is part of a broader effort to maintain the continuity of international trade and travel while managing a pathogen that lacks a specific vaccine or widely available antiviral treatment. Hospital systems in major port cities are also being integrated into this surveillance network. With a focus on high-consequence pathogen preparation, emergency departments have been instructed to escalate any cases of unexplained acute respiratory failure to state epidemiologists if the patient has a history of recent transit through a major international airport. The core of the current clinical challenge is the prodromal phase of the disease, which often mimics less severe viral illnesses with symptoms like fever, myalgia, and headache. It is only when the disease progresses to the cardiopulmonary stage, characterized by rapid onset pulmonary edema and shock, that the severity becomes apparent. Therefore, the CDC's current developments involve a catch-all approach at ports of entry, where even mild respiratory symptoms are being treated with a high index of suspicion. While official statements emphasize that the general public risk remains manageable, the logistics of monitoring thousands of daily travelers through U.S. airports represent one of the largest public health surveillance efforts of the current year. Officials remain focused on the transparency of data, acknowledging that while the threat of airborne transmission is a significant escalation, the goal of these airport-based interventions is to break the chain of transmission before the virus establishes a foothold in domestic communities. Public health guidance regarding the confirmed presence of the Andes hantavirus strain in transit environments emphasizes a two-pronged approach: rigorous environmental sanitation and heightened individual vigilance. For facilities management at major airports and transportation hubs, the prevention of hantavirus transmission requires moving beyond standard janitorial practices. Because hantaviruses are typically shed in the saliva, urine, and feces of infected rodents, the virus can become aerosolized when contaminated dust or nesting materials are disturbed. In the specific context of the Andes strain's potential for person-to-person spread through respiratory droplets, the CDC has updated its sanitation protocols to include the use of hospital-grade disinfectants and a strict no-dry cleaning policy. This means that instead of sweeping or vacuuming, which can kick viral particles into the air, surfaces must be thoroughly wetted with a 10% bleach solution or a similar virucidal agent before being wiped down. This approach is designed to physically stabilize the virions, preventing them from becoming airborne during the cleaning process. For airline staff and ground crews, the use of N95 respirators is now a primary recommendation when working in enclosed spaces where airflow may be restricted or where a symptomatic individual has been identified, for the traveling public. The most practical takeaway is the recognition of early symptoms and the immediate disclosure of travel history to medical professionals. The prodromal phase of hantavirus infection is often indistinguishable from a common cold or the flu, characterized by a fever exceeding 101 degrees Fahrenheit, significant muscle aches in the large muscle groups such as the thighs and back, and profound fatigue. However, the hallmark of the transition into Hantavirus Pulmonary Syndrome is a rapid onset of shortness of breath and a persistent, non-productive cough. Public health officials advise that anyone who has traveled through an international airport and develops these symptoms within 6 weeks should seek emergency care and specifically mention their transit history to facilitate rapid isolation. This 6-week window is a conservative estimate based on the known incubation period of the virus, and it serves as the time frame for active surveillance. To mitigate the risk of person-to-person transmission, individuals showing symptoms are urged to practice strict respiratory etiquette, maintaining a distance of at least 6 feet from others and using high-efficiency masks until they can be evaluated in a controlled clinical environment. The limits of current scientific knowledge regarding this specific outbreak remain a point of investigation. While the Andes virus is known to be the only hantavirus capable of human-to-human transmission, the efficiency of this spread in a high-traffic, climate-controlled environment like an airport terminal is not yet fully understood. Epidemiologists are working to determine the environmental stability of the virus on high-touch surfaces, such as self-check-in kiosks and security bins, as well as the duration for which an infected individual remains contagious before the onset of visible symptoms. There is also ongoing research into whether certain individuals act as superspreaders due to higher viral shedding loads. This uncertainty is why the CDC has adopted a precautionary stance, treating the situation with the highest level of surveillance, even while asserting that the risk to the average traveler remains statistically low. The agency's focus is on the containment at the source strategy, which relies on the rapid identification of cases to prevent the virus from moving from the airport environment into local communities, where rodent reservoirs might facilitate a secondary, more permanent cycle of infection. Ethically, the reporting on the Andes virus demands a balance between public transparency and the prevention of unnecessary alarm. Health agencies are tasked with providing enough detail to ensure public safety without stigmatizing specific travel routes or demographics. The ethical responsibility of the individual in this case is the commitment to honest reporting and cooperation with contact tracers, should they be identified as a potential contact. This collective vigilance is the most effective tool in the absence of a vaccine. As surveillance continues, the public is encouraged to rely on verified updates from the CDC and the World Health Organization rather than unverified reports of widespread outbreaks. By adhering to established hygiene protocols and remaining aware of the symptoms, the risk can be managed through science-based interventions. This concludes our report on the current hantavirus surveillance operations. For more in-depth coverage of global health security and emerging pathogens, please consider subscribing to this channel.